Hello and welcome to the Doc Podcast. I'm your host, Dr. Mike DeLuke, and it's my mission to help you lead a happier, healthier, and more prosperous life, both personally and professionally. Hello and welcome to this episode of the Doc Podcast. Today I have the privilege of being joined by Dr. Paul Henny. Dr. Henny is a graduate of the University of Michigan School of Dentistry and former associate faculty at the University of Kentucky College of Dentistry, as well as at the Penke Institute. He is co-founder of the Bob Barkley Study Club, founding partner in Mark IV Dental Consultancy, a national speaker, writer, and author of the excellent book, Co-Discovery, Exploring the Legacy of Robert F. Barkley, DDS, which we will be talking about and referencing throughout today's show. Dr. Henny practices restorative, aesthetic, TMD, and airway-focused dentistry in Roanoke, Virginia. And today, he and I are going to take a deep dive into the psychological and philosophical sides of what we do as clinicians and healthcare professionals. This is such an important topic because while dentists talk and learn a lot about how to execute a treatment plan, we oftentimes don't focus enough attention on the actual person, the entire person, the patient who is sitting in our chair. All too often, we just want to get to the procedure, get that done, and move on to the next patient. As a result, dentistry can become very mechanical and even rote, and the numerous stresses we are forced to endure can seem overwhelming and void of purpose. As I've discussed with other guests on this show, this is one of the reasons why many dentists struggle with depression, substance abuse, and even thoughts of suicide. But why is that? And can we do anything to change it, or is it just part of the job? Paul has thought about and researched this topic extensively, and we'll discuss that and much more today, including why Paul almost walked away from the profession of dentistry, the industrialization of dentistry and the impact it's having on our profession, the importance of having a vision for who and what type of practitioner you want to be, the need to take the time to get to know your patients on a deeper level, how taking a preventative approach to dentistry can be much more fulfilling and rewarding than the typical reactive approach that so many of us take, the impact of dental insurance on the profession and how we can break free from the reliance on insurance-based fee structures, why lowering fees to get patients in the door is a race to the bottom, how to find true fulfillment and purpose in your work as a dental professional, what Paul sees as the future of our profession, and we'll also talk about the story of Bob Barkley and how his legacy lives on today. So without further ado, let's get on to today's episode with Dr. Paul Henny. Enjoy the show, everybody. Welcome to the Doc Podcast, Paul.
Thanks for having me, Mike. I'm excited to be with you.
Yeah, I'm really excited to have this conversation with you. As my audience knows, or the people have listened to me for a while now, and as those who haven't, just to fill you in, I like to come at our profession from different perspectives, from a clinical standpoint, from a philosophical standpoint, from a financial standpoint, a behavioral standpoint, because I really feel that to find happiness, fulfillment, peace, enjoyment in what we do, in life in general, but especially in this profession of dentistry, we need to have knowledge and education in all of those areas. And we rarely learn how to find fulfillment and success in all of those areas. Our profession becomes somewhat mechanical, somewhat task-focused. That's in our schooling, and it's when we get out, and we're going to talk a lot about that today. But as somebody who went through this and has been down that path, I would love for you to just take a little bit of time and share your journey in this profession and how you went through a lot of the trials and tribulations you went through, how you emerged from them to be in a better place, to help encourage especially some of those younger docs who may be having some similar thoughts, and also the older docs who are later in their careers and may be struggling to find that purpose.
Sure. I guess we share sort of a common background in the sense that we're both from professional dental families, and that's my strong history. My father was an oral surgeon. My uncle, my father's brother, was one of the most famous oral surgeons of all times and really pioneered a lot of head and neck surgeries and stuff at Ford Hospital in Detroit in the late 50s, 60s, early 70s. and president of the academy, the whole thing. So he was the Peter Dawson of his time. And so being
What
a
was
dentist,
his name, Paul? If you don't mind me asking.
Frederick Henny. Frederick Henny.
Frederick Henny, okay.
And so being a dentist in my family was a major deal. I mean, it was a very honorable profession, and that was really instilled in me very early on that you're carrying the Henny name and you need to represent us well in the community and so on and so forth. So that sort of family culture of dentistry and growing up around my father's office and a lot of my parents' social circles was around dentists. So dentists were around our home a lot for dinner and other things. And so I decided to be a dentist pretty early on, 12, 13 years old. And
it's eerie how similar.
Yeah. In the beginning, I thought I wanted to go into orthodontics, believe it or not.
Wow.
But I was pretty clear about that. So by the time I got to college, undergraduate, that was my sole focus. I was working on that. And I went to the University of Michigan, where my father and my uncle went, and my brother as well. And so I had an idealized, I can look back at it now and say I had an idealized version in my head of what dentistry was and what could be, because I was in this bubble. And we didn't really suffer any significant hardships other than at that time. The reason I'm not an oral surgeon was my father. At that time, it was the oral surgeons that were in the emergency rooms. They were the ones that were called in the middle of the night to put people's faces back together, and they would do the surgeries in the middle of the night. And I can remember.
Same with me. That's the same reason I didn't go into it. Yep.
Yeah, I can remember my dad just groaning at 2 o'clock in the morning when he would get those calls, and I thought, I don't want to do that for a living.
Mm-hmm.
So when I came out of dental school, I had this expectation that being a dentist was a very respected thing. And when I got out of school and got out of my residency, and I was lucky enough to get 3 associate professorship positions down at the University of Kentucky Dental School, in combination with just taking an associateship position. And I loved teaching at the dental school, but as soon as I would go into this very insurance-centric dental practice, I was not really respected much by the patients. They really didn't want to listen to what I had to say or what I knew. And I was just struck by it, but just struggled through it. And I'm sure this is something that every dentist that got out of dental school experienced in the very beginning. You leave the bubble of academia where everybody's cooperating and they want to be there for various reasons, and you go into a private practice setting, and there are all kind of other motivations for people being there. One primary one being insurance. And when you don't have a relationship with the patient, it makes it very difficult for you to make recommendations and have them even want to listen to you. So after doing that for just a couple years, I was getting very disheartened by it, frankly. And I was trying to figure out whether I even wanted to be a dentist, a general dentist anymore. And to address my anxiety and maybe create a grand distraction, I became a co-partner in a new kitchen shop, a very fine, high-end kitchen shop in Lexington, Kentucky. And my partner was the money guy, and he was running a very fine tabletop store at the time, and he was a fantastic real in retail. He'd made his money elsewhere in the hotel business, but he was having fun running this beautiful store, basically selling to all the blue blood horse people in Lexington. And he said, I'll put up the money, but you'll have to design it and go to market and merchandise it and take care of running it and managing it. And I jumped on it. And so I did that. That was the other plate spinning in there that I was doing, teaching, trying to run this, being an associate in a practice. And then I started up this business, and what do you know, the business takes off like a rocket. And we're making a lot of good money. It's a lot more fun. It doesn't require nearly as much mental energy. And I'm meeting all kinds of people who want to be there and who want to buy things from me. And I'm going, well, why don't I do this? Why don't I do this for a living and just maybe teach part-time or even leave dentistry altogether? So the event created a crossroads moment for me to
And about
decide.
how far into your career? Sorry to interrupt. Were you at this point? How many years?
It was just like 3 years in.
Oh, so he was pretty okay.
Very early.
Not that far in. Okay.
Primarily because this little side business that I'd set up had just taken off unexpectedly well. It was before Williams-Sonoma had really been all over the place, and we had the corner marketed. And so concurrently, I met a restorative dentist in Lexington. His name was Bob Muncie, and he'd been training at the Pankey Institute and has had a very successful restorative practice. Every case that he was doing was on articulators. He was doing a lot of high-end aesthetic dentistry, reconstructive dentistry. They were even placing implants back at that time. This was in the mid-'80s. And I got a glimpse for the very first time about what the kind of leading edge of dentistry was doing and what that looked like, both on the technical level, but also on the behavioral level. People were there because they wanted to be, and they were creating outcomes that everybody was excited about, and he was well compensated. And it was the complete opposite of what I was experiencing in my little insurance-centered experience in dentistry. And so it started to give me a vision of what was maybe possible if I pointed myself in a more of a developmental direction. The other thing that happened to me right at that time was Bob said, "You need to meet this other dentist in town. I think you'd really find him interesting." And his name was Walter Doyle. And Walter Doyle was the first double board certified pedodontist orthodontist. And he had done that maybe around 1960 or 1961 at Indiana University. And at the time I met him, Walter was in his maybe mid-60s. And he had taught at Boston University, he had taught at Northwestern, he had taught at the University of Kentucky. And the final phase of his career was he had set up actually a teaching center in his practice. So on the lower level of his office, he had a teaching center, and people would fly in, dentists would fly in from all over the country, I think from Canada as well. And they would live at his house. He had this antebellum mansion outside Lexington in the horse country. They would stay at his house, and then they would come to his office, and for 3 days they would do clinical training with him one-on-one, and he would teach developmental orthodontics. So he was doing palatal expansion, he was doing mid-face growth and development, all this stuff. Every case that he was doing, he was putting on a SAM2 articulator and using an axiograph on, so he was looking at the condylar function, he was looking at everything. And I walked in this office, and it just blew my mind. I had no idea that orthodontics could look anything like this at all, because my family orthodontist, when I had braces, wasn't doing any of that. And the combination of these two things, these gentlemen who had taken dentistry to the highest of heights, and in Walter's case, teaching dentists from all over the world, I think the majority of them must have been pedodontists who were trying to integrate orthodontics. And it's funny how this is all cycled now, how this has become the rage. At the time, I barely knew what I was seeing and the significance of it. It took me many years to understand what exactly I saw and experienced there, and how much orthodontics has moved in that, and pediatrics as well has moved in that direction, this awareness. So these two people, I was just at this tipping point in my life. What am I going to do? And fortunately, I got in touch with these two people who fascinated me with what they were doing in dentistry, and I decided I was going to get out of retail, get out of clinical practice there, and focus on developing myself. So that went on to me going to Dawson and Pankey and studying in many places and creating that vision in my mind, which is very interesting. Another interesting topic, just a couple years after that, we all had Franklin Day planners at that time in our life, and maybe you did as well. And I had one, and in my Franklin Day planner, I actually wrote down 127 things that I wanted to do, even visualized what I wanted my future office to look like and what I'd be doing there. And so after me moving several times and learning at many organizations and so forth, I had lost my Franklin Day planner. And like 10 years ago, I found it in one of my boxes. I opened it up, and I had done every one of those things.
Oh, that's so awesome.
And it's just a perfect example of how your mind works. If you just upload it, over time, it will seek opportunities out to fulfill those things that you do. So I'm a living example of that. So my current situation, interesting enough, is I do complex restorative dentistry, I do orthodontics, and I have a teaching center in the bottom level of my office associated with the Bob Barkley Study Club. So this pregnant moment in my life very early on, just a couple years out of dental school, influenced the direction of everything else because it put in my mind what I wanted to create for me to be happy and fulfilled. And the other thing that I sort of realized that dentistry is sort of like a marathon. It shouldn't be a sprint. So I need to set it up in a way that it's not overwhelming, it's not too physically demanding, and that it's intellectually challenging. So at this point, I'm like 41 years in, and I'm nowhere near ready to stop. I'm still learning stuff and integrating stuff and teaching younger dentists about maybe a different way to think about dentistry and practicing. So, I'm just in the next phase on it. So to a large degree, my point of view is dentistry can be what you make of it, and a lot of it has to do with how you think about it and what your role is in the lives of patients.
Yeah, boy, that's such a great story. Thank you for going through that, encapsulating that, and your journey. And that's why I love this so much, because you have been through many of the trials and tribulations. You were ready to walk away after coming out of school and all the time and energy, a family of dentists, which, as you said, we share oral surgery on top of that. Many know, but my dad and two of his brothers are general dentists. A third brother's an oral surgeon, and their father was an oral surgeon. Also, my grandfather, very prominent oral surgeon, was a leader in the Northeast and was affiliated with Columbia University and subperiosteal implants and doing things way ahead of his time in craniofacial. Actually was one of the first dentists credentialed at a hospital, fought to get dentists on faculty, because people don't realize back then, dentists, he would tell stories. They had a separate room in the hospital for the physicians, and the dentists weren't, once he even broke that barrier and got in, they wouldn't let them in the room. I mean,
right.
People may not realize. So when you come from these traditional dental families, you have this idea of what dentistry is. And then you get out there and you start to see that it's not the reputation that your family's built and in the community and all of that, that doesn't come right away. And then you start to see, as you saw, other facets of dentistry where you're an insurance-based practice. And I think so many people, we'll talk a little bit more about this in a bit, find themselves in these insurance-based corporate-type environments. And while there can be a place for them in situations, they might not bring them the fulfillment and certainly the patient connectivity that we all, I think, crave and sometimes lack. And so then when you found that, the other part I love is there's always these people, these little angel moments, sort of whatever you believe in as a higher power of anything, but God influencing your direction, but with Bob Muncy and Walter Doyle and meeting these people. And why did they happen to walk into your life or you into theirs, right, at the time that you did? I mean, there's just some things there's just not explanations for, yet you were at a crossroads, and had you not met them and helped then you build the next part of what I love is a vision. And I talk about that all the time. I had the pleasure of being a guest on Dr. Brett Gilbert's podcast, On the Cusp. He's a great guy, endodontist, and he's doing a lot in the mental health arena to try to help our colleagues who are struggling in that way. And we talked about my journey, and one of the things, I think he actually titled the episode, "What does 20-year you look like?" You've got to write those goals down. Here you are in your Franklin Planner, which for the younger docs out there was our version of our or our Apple Calendar, our Google Calendar, and where we made all our little notes and everything. And you didn't go anywhere without it when you were in your schooling years. So the fact that you wrote this down and you took the time to think and be critical. And then the last part is, it's not always going to be roses. It's sometimes it's going to be a grind. And a episode I had with a real estate guy recently, David Valley, he said he doesn't love the word grind in the sense that people use it like the grind is good. He feels it's a flow. And he said, when you're really hitting your purpose, you're in a flow state, not in a grind state. But the way I kind of tweak that is, I think a lot of us have to go through a grind state to get to our flow state. And I feel like we should just be in this sort of kumbaya. I'm now a dentist. Everything is great. I'm going to do well financially and solve problems for my patients. And we don't realize that when you get out, that's almost when the grind 2.0, grind 1.0 is school. Grind 2.0 is the day you walk out of that institution. And as you said, it's very protective, the educational institution. It's insulated against the outside forces that come at you very quickly in private practice. So with that, I want to talk a little bit about, because a lot of those themes tie into the book that you wrote about Bob Barkley, titled Co-Discovery, Exploring the Legacy of Robert F. Barkley, DDS. It's a great book. I really hope people read it. I really enjoyed the messages in it. You put a lot in there. I mean, it's impressive what you went into detail. But with Bob, why did you find companionship in his message? What about it appealed to you and motivated you to try to commemorate his life? And we'll talk a little bit more down the road about the study club. And one thing I want to add on that is I actually share a birthday with Bob Barkley. When I read the part, when he said August 23rd, he's 46 years preceded me. He was 1930. I'm 76. But yeah, August 23rd. So I was like, oh my gosh, when I read it. But yeah, talk a little bit about him and why you decided to write this book.
Well, let me benchmark that because that kind of ties in, dovetails with what I've already shared. When I would go over to Bob Muncie's office, and he would just let me hang out and observe him. And he had 3 operatories set up exactly alike, so it didn't matter whichever room he was in. Everything was right there. And I can remember he had like 4 Cavo handpieces. It was all set up so that he wouldn't have to change a burr when he was doing a full mouth prep. Everything was just flow, flow, flow. And he was very much into time and energy study and all that. But when he was too busy to be able to talk to me, he would let me sit in his private office. And his private office, on the shelf were these books, whether it was professional journals or other things. And one of them were these journals from this guy, this consultant in dentistry, this social psychologist that got into dentistry named Avram King. And he produced a newsletter. It was called Nexus. And Avram King was a close friend of this guy named Bob Barkley. Bob Barkley was a dentist that practiced in southern Illinois starting in the late 50s and into the 60s and until 1977 when he died in a plane crash. And Bob basically went back home to practice near where he grew up. So this is not a well-to-do area. There's a Western Illinois University is there, but mostly a farming community and supporting businesses of that, and then the university stuck in the middle of it. And so Bob went on a similar professional development journey. He came in contact with L.D. Pankey and other kind of thought leaders of the time around 1960, early 60s. And so he was learning all these advanced training, and he went to Northwestern, which was an excellent dental school as well. And he brought all this advanced training and thinking into this small community, and nobody was really interested in buying it because it really wasn't part of the culture really of anywhere in the country, but particularly there. I mean, the culture was when a tooth is bad, you just take it out, and everybody's in some version of a transition towards dentures. And I read that the average number of permanent teeth in a 65-year-old's mouth at that time was 6.
Whoa.
So you can think how counterculture it was at that time for you to be proposing full mouth restorative dentistry or fine onlays and inlays and the kind of things that he learned at Northwestern and other places. So he's like the average dentist today, myself included, that goes to Pankey or Spear or Coyce or wherever, and they learn all these amazing things, and they come back to their community and nobody says yes. And then they're trapped in what insurance will and will not cover, and all of a sudden they're just hemmed in. And I think this is a big source of the frustration. We know so much, and we're allowed to do so little. And the patients aren't really capable of appreciating what we can do, and even sometimes when we do it, they're not capable of appreciating that either. So that was Bob's conundrum. And in the book, his book that he wrote, he says, I was at a crossroads. I had to decide I was either going to lower the standard of care down to what everybody else in town was going to do, or I was going to do dentistry at the level I knew how to do it and what was appropriate, and I'm just going to let the chips fall where they may, is basically what he said. And so he chose to go down the proper, complete restorative dentistry path, proper, complete exams, proper case presentations, all that stuff, and he was confronted with rejection after rejection and patients leaving the practice. And he realized that the problem was he was not able to communicate well with his patients the value of what he had to offer. Not that what he was proposing was wrong, but the people weren't able to understand the value of it enough to say yes. And the other piece of it was a lot of them couldn't afford to properly restore their mouth, so there was a financial barrier there too. So Bob went on a multi-year journey studying with a PhD educational psychologists, and many other people, and focusing his attention on communication, how people learn, how to redesign his examination process in a way that people were more capable of understanding where they are, understanding how things are trending, open up the conversation to what they would like to see happen over time, things they'd never talked to a dentist about. What would you like your future to be like in dentistry? And most people, of course, at that time and even now would say, well, I sure would like not to end up like my mother because she can't hardly eat anything that she wants and things like that. And getting people to, and this is the same thing as the vision, getting people to future focus on a preferred long-term outcome and then getting them to buy into a restorative plan. That might not mean that they could do it immediately, or it might mean that they would need to do it in phases, but he would partner with them. He would call that a therapeutic alliance. I want to form a therapeutic alliance with my patients. So we're partnering in some shared goals based on some shared values and an outcome that we both really want to see happen. So he became really good at teaching that in concurrence with teaching preventive dentistry. So the kind of the linchpin that made all this work was he spent a lot of time and energy and money in getting people to learn how to take care of their mouth better so that they could stabilize their disease state. So if they came in with perio and active caries, he would get the disease state arrested, and then he would say, now that we've got the disease state arrested, what do we want to do next? Let's plan for an optimal future rather than jump in and just do things that the insurance plans covered and things like that. So he kept things in the right order, and he waited for people to be ready. And then over time they would get their resources in order, they would save their money and do various things. And he would complete these full mouth restorative cases, and he would take him up to this high-level study club that he was involved in Chicago, and he would show them all these cases, and all the dentists up there were going, well, Bob, you're in Macomb. How do you get people to say yes to this kind of dentistry? And he said, well, it's easy. They said yes to this 2 years ago. We just finished it now. Yeah. So he just knew how to get into people's minds, not in a manipulative way, in a helping sort of way, and help them take charge of this aspect of their life that nobody had ever taken any time to help them understand on a level that they could make more sophisticated decisions. And so he did that, and then ultimately went out, he wrote a book, and he was the most popular lecturer of all in dentistry. In his day, he had a private plane. He'd fly around to all kinds of study clubs or fly up to Chicago and then take a hop to big cities and speak all over the place. So to loop back around to why it touched me is that I practice in a town that's not demographically perfect either. We probably are, per household income, we're probably at least half what it is up in the northern part of Virginia, the greater D.C. area. So we're kind of a post-industrial place, similar to where you practice in New York, struggling to find a new reason to exist. So what happens to these communities? The school system and the hospital tend to be the big employers, and the city workers and this and that, and they're all on Delta Dental, and that's what drives the bus. And so I was in the same situation. I'd gotten all this training. I knew how to do this, a lot of this sophisticated restorative dentistry, but I was having a hard time getting people to say yes. So when I started reading Bob's predicament and how he solved the problem, I just started testing some things out and doing things in a similar fashion to the way Bob did. And sure enough, the people responded. These are not rich people in my practice. I have some well-to-do people, but the average person is just an average, very middle-class person who just values their health and wants me to help them achieve some goals. And so this whole therapeutic alliance thing is like the key to the door to success. And it's so fulfilling, too, because I look forward to coming to the office. I work at an office that I designed, every aspect of it, right down to the color of the paint, the size of every drawer. And so the space is something, just like a home, like your dream home. I'd built a dream office. So every time I come in here, everything's exactly the way I want it, where I want it to be. And the people that are visiting me every day are people that I enjoy being around. So how can you not be happy in dentistry with that circumstance? So that's kind of how it ended up, or is still ongoing for me right now. And I'm just transitioning more into teaching other people more about these ideas because they're still as relevant today as they were back in Bob's time. People haven't changed. The human mind has not changed at all in that time period. And the influence of insurance has become more prominent, but it's something you can get around. It's the lowest common denominator that people will reference when they don't know anything else, when they don't know any better. So that's the story there.
What you just finished up saying on that, I want to just go a little deeper into that, because one of the things I find that I hear a lot from teaching and coaching younger docs especially is, yeah, but it's different now, Mike. You know, I mean, I'm old enough to be a generation removed from these younger docs now. You're probably, generation and a half, so to speak, removed. And it's this feeling that, well, when you guys did it, and I have to be honest, I've felt that with looking at my father and his generation and how they practice, right? You think, well, it was different. And granted, some things are, right? The technology, the marketing, the constancy of job turnover with having these online apps that people can access jobs and job hopping, IT issues and headaches and all of the digitization. It's been wonderful in ways, but it's also created a lot of extra stress and headaches. The debt. One of the things that you wrote in the book, which was a quote from Bob Barkley in 1973, he said, "I cringe at the thought of the size of some dentists' loan payments and therefore how much they need each patient. When we put ourselves into a situation where we need patients more than they need us, we are going to have a communication problem right out of the gate." That was over 50 years ago.
Right.
And I read that and I looked at 1973. And so kind of cliche, all that's old is new again. I feel like what you said was really profound in that is the human nature doesn't change as much as we think it does. So yes, there are a lot of different extenuating circumstances, and maybe the debt is bigger now. Maybe more people are going into significant debt, right? We certainly can make those arguments. The part that I love about the book and about what you're talking about is it almost takes the side of, okay, there is all this noise. You may practice in a town that's of people of lower socioeconomic means. You may be in a more insurance-based practice. You may work for a corporate, and there may be more corporates now. But the human condition and humanity hasn't changed. And I feel like what's happening, and you can certainly disagree with me on this, and I want to hear your thoughts. I feel like what's happening is we are looking at all these extraneous factors and we're losing our humanity to some extent. We're thinking that mechanical nature of dentistry, which it can be very mechanical and rote, right? You put your head down, especially general dentistry. I did that for a few years part-time when I was in my orthodontic residency. It's an intense grind, and as is orthodontics in a lot of ways. Even though a lot of people think the orthodontist is just kind of the checkodontist, when you're doing really high-quality ortho, it's intense. I mean, you're doing a lot of heavy lifting to get great results. So we have all that stress, and I feel like all of those things are pulling us further away from the reason we went into this, which is that patient-centered approach, right? So how do we right that? How do we reconcile that all these external stimuli we're chasing, and it's pulling us away from the chair time and the connection to the patient that L.D. Pankey talked about and Bob Barkley talked about and you're talking about? That is what really fulfills most of us. I mean, how do we square that?
Right. Well, I'm a firm believer that most people go into dentistry because they're in their deepest heart of hearts, they're helpers, and they want to help people. That's why they went in. At money, certainly they can have a nice lifestyle, and it's certainly less crazy and hectic than a lot of other professional lifestyles to be able to maybe work 4 days a week and be able to predict what weekends you can have off and be in control of your life on that level. It has a lot of appeal. But I think at its core, most dentists are helpers at heart.
Yep.
And what's happened to dentistry, I think the key to answering your question is, first, we've got to step back and see what's happening in the marketplace. Sometimes we're so far inside of it that we lose perspective. Mm-hmm. And we're in the middle of I don't have to tell anybody this, that we're in the middle of a massive corporatization of our profession. Exactly the same thing that happened to the profession of pharmacists. Mm-hmm. The pharmacy, used to be that the local pharmacy was owned by a single guy or gal that lived in the community and went to church with you. That's all gone
Sure.
for the most part, with a few exceptions. Investors, fund investors, people that are responsible for investing all of the funds at Harvard or Columbia or whatever, the teachers fund, they're looking for ways to make a ROI on investments. And they see dentistry, because it's not nearly fully consolidated yet, it's somewhere around 25% has been corporatized. They see it as the next pharmacy opportunity where they can make a lot of money over the consolidation, what I call the industrialization of dentistry. And a lot of money has been made by third parties in this, and dentists are getting caught up in it because they are in a lot of debt, and a lot of their first job or opportunities are in these types of organizations. The plans of a DSO is to buy up a practice, and they understand that the owner-operator doctor is going to be gone in a few years, but they're just going to plug in another body. So what's the net of all of that happening? As that corporation maybe sells to another corporation and the money gets pursued more and more down the road, the relationships with the doctors and the patients is totally broken down, as we see in medicine now. If you're going into dentistry to be a helper, and everybody, for the most part, that's coming in the door, you have a very shallow, superficial relationship with, and you're frustrated a lot because you're just not able to connect with them and get them to move more towards health or make good decisions. It gets very, very frustrating. And dentistry is too damn hard, in my opinion, to be doing that on strangers day in and day out. It bleeds your soul dry.
That's such a great
And
line.
so if you're not working with people that fulfill your soul to some degree, that hug you or you hug them back, there's something that's a lot more valuable, in my opinion, even than the money going on every day. Then dentistry is a very, very hard way to make a living. And I was just on my way into the office this morning, I was listening to a gal who had previously been an investment banker in Manhattan. She said, I just had to leave. It was like killing my soul. All they cared about there was money. And, I see dentistry going down that same road. It's I think, being ruined by this industrialization process. We're just in the early stages of it. But I think the outcome is going to be not good for dentists spiritually or otherwise. I think they'll find a way to reduce the incomes shortly after they get control of the whole thing, too. So I think
is there anything we can... Oh, sorry, go ahead.
Yeah, well, so... That's not the entire market. I think the key takeaway of that conversation is that there's always going to be an opportunity for a private care, personalized version of dentistry that's outside of all of that.
That's what I was going to ask.
You just have to be a little more entrepreneurial. You have to be a little more savvy, like Bob Barkley was, with understanding how people think and how to motivate people and how to get people to look towards the future and to collaborate with you. So it's almost like, I've always thought of the analogy of you working with an investment person, and you hire them and you go in, and I have X amount of assets, but in 25 years I want to have X plus 100 assets, X plus 50 times 50 assets. And so they're working with what you have towards a long-term goal, and you're collaborating together. You're investing more and saving here and there and making various decisions. You're partnering together towards a chosen future. And I think if we start to think about dentistry more in that terms, that therapeutic alliance that's future-focused, and every decision that we make today is related to that long-term goal, then things make a lot more sense to us and to the patient, and we more often than not create outcomes that we're both satisfied with over time. And it creates an environment where there's a lot more loyalty instead of just chasing after who's got my plan and so forth. So I think I've said for a number of years now, the worst this situation gets with regard to corporatization, the better it's going to be for the dentist that understands these entrepreneurial opportunities that are on the side. Because one of the other bad things about this corporatization movement is it's very good at standardized care, just like at the hospital and so forth. But anytime you get out of that lane, they don't have the mindset or the resources to really want to deal. They don't really want to deal with you because you take too much time.
They're aiming for the 80%.
Right. And so, and this is true in dentistry, a lot of our patients have complicated problems, more complicated than we even
Agreed.
see initially, unless we're looking at it carefully. And if your practice is majority adult, you're looking at a system that's already adapted and changed and changing. And that might be at the joint level, that might be at the tooth level, that might be at the breathing level. This is a system that's trying to adapt. And if we don't have that kind of more complex view of the situation, then we're treating people sort of like a mechanic that doesn't fully evaluate the automobile. We're just, intercepting problems as they arise.
Reactive treatment.
Yep.
And the irony is that's the least fulfilling treatment for us and for the patient, right? Like that's what gets us to that's when it becomes rote. That's when it becomes mechanical. That's when we feel like drill and fill type of docs or pull, in the oral surgery and just pulling wisdom teeth for what the insurance will cover, for orthodontists just straightening some teeth. It's this vicious cycle we get in where the system is set up to put us down that path, and we initially think, oh, well, this is a way to start to make a little more money more quickly, right? Because I acknowledge a lot of these young docs especially are coming out in a lot of debt, as we said, but you become a victim of the system because you think, well, I'm still doing dentistry. I'm still helping these people, right? Because I agree with you. I think most people that go into this profession are tremendously altruistic and go into this for the right reasons. And it's like that frog in the boiling water. You don't know that you're starting to cook your soul and, until it starts to get too late. And that's when I think we find this tremendous depression that starts to set in, the suicidal ideation, all of the things that are very, a lot of people don't like to talk about in our profession, but it's real and it's out there. And I've never heard so many young docs in my career, from going back to when I was a resident, starting almost 25 years ago now, who say that they want to practice for such a short period of time once they're done with school. I've never heard this before. Like this is in the past 5 years, it is how quickly can I make enough money to get out of this? I wish I were kidding, Paul, but that is literally a conversation I have with a lot of the people that I coach and help. And when you said about it filling your soul, and instantly, when you said to get a hug from a patient, instantly I thought about, and I talk about this a lot, one of the reasons I became so passionate about the proactive, get to know your patient, health-centered, person-centered approach, all things you talk about in the book, was when I started proactively treating these younger patients. I got to know them on a deeper level. I didn't just look at their teeth, meaning, oh, they've got 5-6 millimeters of crowding. Can I solve this without extraction now, or can I wait? Which is the typical. That's about as deep as we usually get with our patients in our training. And I started saying, well, why are they crowded? What's happening with this patient on a greater level? Is it related to their breathing? And it's not always, but I took the responsibility to say, well, I need to start to figure some of this out. And Paul, those are the patients that when you do figure it out, that when you get to know them and you get to the bottom of it and you get them the right help and get them to the right medical colleagues and do what you're going to do orthodontically, those are the ones that hug you at the end, the parents, but even sometimes these little kiddos, 7, 8 years old, they're like, they know you've helped them. They feel better. They're thriving. And I've said so many times to people who question the whole early treatment and benefit it can have, why orthodontists shouldn't be involved in airway, and that's not the point of this episode, but it's relevant and ties into this point. I said, just try it once, because I'm telling you, as soon as you have that experience, it changes you. You can't not feel something in it filling your soul. So what would be your advice to people? Because I have to admit, I don't think I'm the best at doing this, getting them to take that leap, right? I can show them what it's like when they take the leap. I can explain it. I can even teach them how to do it. But how do you mentally, philosophically, and can you use any of the teachings of Barkley to help some of the people listening who are thinking some of these thoughts, who would love to be able to do this, but they just don't know how to start?
Let me give you an example of a case I'm going to finish up on Monday. This is a gal that's around 40 years old, very bright student, went to a very good college, got into a bad marriage. She was physically abused, got addicted to opioids, destroyed a significant part of her mouth, lost vertical dimension, lost a number of posterior teeth, became a recluse, could hardly come out, was embarrassed, ashamed of herself. So the first day that I met her, her mother brought her in because they had heard about us and how I work with people. And the first day, she just sat in my conference room and cried. On the second day that we met and just started the conversation about what is possible and what she might want to do, she cried. I've restored her upper and lower anterior, and on Monday we're going to place the posterior implant restorations, and we'll be finished Monday. This is the case that's taken a year and a half, close to 2 years, in collaboration with my periodontist who placed the implants. I literally saved this gal's life. I mean, she was near suicidal. I'm giving her the opportunity to look in the mirror and feel good about herself for the very first time, to feel like she actually has the capacity to take charge of her life again and to get some of these bad decisions and bad experiences behind her. And every time she comes in, she hugs me and thanks me for being so patient with her. And there were some difficult times where she challenged me on this and that, and I had to get a little hard and firm with her, you know, because she would get scared and try to cancel out at the last minute and things like that. And I said, you know, I had to assume the kind of tough love position on a few, you know, just like a child, assume that leadership role at some times, and then she would relax when she knew I was in control and was trustworthy. But
gaining her trust.
Yeah, I mean, these are kind of patients that I never would have even wanted to consider working with 20 years ago until I learned some of more of the behavioral skills that I use regularly right now. So, you know, I guess the bottom line there is there are a lot of these opportunities out there if you understand what's going on with the person and you're willing to invest the time to get to know them. Yesterday, I had another patient similar to this. She'd been walking around wearing a black surgical face mask for a number of months because she's embarrassed by her teeth. And she's she's the supervisor on a board in a school district south of here. I mean, I think what drove her in was she knew that she was going to be in this very public position all the time, and she had to do something. But her shame and everything had kept her from making any decisions, and her memories of bad experiences with other dentists just stopped her from taking any action until she heard about us and how we work with people. So yesterday we began the same process. What do you want me to do? We can take a reparative approach and just watch this situation slowly slip down the hill. It'll take us several years more for that to happen. Or do we want to just stop the clock here and maybe envision an optimal future and have a conversation around what that would look like? And then we can back up and see what that would take and how long that would take and how much money that would take. And so, I'm starting with a really phobic person who had never had any real significant leadership in her life with regard to dental health, and I'm bringing her up slowly at a time, basically using the tools that I learned from Bob Barkley's work. And human nature is human nature. I mean, most people have an inherent desire, almost everybody has an inherent desire to want to take care of themselves and to be better. They even have a whole lot of barriers in the way, but that's an aspiration. And they're not used to having opportunities or even conversations about opportunities like that with dentists. They're usually used to going in, feeling ashamed, being scolded a little bit here and there, and then told what they have to do, a to-do list of all things that are wrong, and then this is what you need to do, or you're a bad person or something that's kind of implied, rather than seeking to partner and collaborate together on a chosen outcome. And that takes time. It takes effort, and it takes a mindset and a philosophy of practice that's a little bit different, but it's the same story that Bob Barkley told to the study club in downtown Chicago. Well, Bob, how did you get to do these big, beautiful cases? Well, she decided to do that 2 years ago. We just finished it now.
So if you're in the system, though, of a corporate or a senior doc, that doesn't, because you said the time, and I agree. That's one of the things I teach is how to be more efficient with this, because a lot of people are intimidated just by the extra time. I say it all the time, and I don't say this to be critical of my ortho colleagues, but it's all known, so I might as well just put it out there. A lot of orthodontists, their consult is they look at the pan, maybe the Ceph outside the room real quick. They walk in, they take a mirror, the patient's sitting up, they look real quick, tell the parent, yep, they can wait or know they're ready, and about this is how long, and they walk out and the treatment coordinator can go over the case. And they will, I guess, probably justify that as I'm busy, right? My time is better served in the clinic, working on these patients and moving them along. I actually have a different approach to that, and that is that you wouldn't have so many headaches and challenges in cases that may not be progressing the way you want in the clinic if you took a little more time in the diagnostic and treatment planning process. And you can learn how to do that, much like Bob Barkley talked about. There's ways to do these things. It doesn't mean you need to do a 3-step visit in orthodontics for every ortho case and spend every second measuring every little detail. You can do this in 10 minutes, literally, when you get good at it. You have to put work in to learn how to do that. And a lot of that work comes in the communication side. But the challenge becomes, what if these younger docs especially are in an environment, or even older docs, that their colleagues, partners, corporate entities won't allow them that time to do this. And they just feel like, I'm just a hamster on this wheel and I want to do that. I hear what you're saying, Paul and Mike. It sounds great, but I can't do it.
What's the solution to that?
Yeah.
I mean, my opinion, I think that you've got to get yourself out of those constraints. You need to work on developing your skill set, and then as soon as you work for a corporation, you're working under their philosophy for the most part. That's exactly what you just described to me. They're going to tell you how many minutes you get to have and what's the standard of care in this place. And if you aspire to have something higher, I think you've just got to get out of that environment. That's a matter of just saving up your money and looking for a private practice opportunity where you can be calling the shots. Mm-hmm. And the downside of that is when something goes wrong, you just have to go in the bathroom and look at the mirror and say, I did that. That was my decision. Mm-hmm. That was bad judgment on my part. I own that. But you get better and better at that over time. There's benefits and downsides to being independent practitioner. And I would encourage people to try to get themselves in a position where they're the ones that are dictating the philosophy of the office, and they're the ones that are training people and selecting people and designing the facility in such a way that it supports it. And when you get to that place, then you got control of the whole game board. And then I think that's really when things get more consistent with you and you're more effective working with people one-on-one.
I agree. And from my standpoint, and you talk about this in the book as well, the seasons of life and the seasons. And so it's okay, I feel, because I faced this in my own career and what I decided to do in transitioning from having a very successful practice that I built from nothing to the more academic side now. And a lot of people say to me, how did you do that? Or do you miss this? And I was looking in the mirror and realizing that I had a different purpose for the second half of my career than the first half. And I never questioned it, because once I made that decision, I knew I was no longer on the path that was fulfilling my soul. And I didn't regret any of the time I spent in my private practice. I wouldn't be able to be the teacher I am without all of that. I'm tremendously appreciative of that. So I just want to encourage people out there to realize there are seasons. And that season might be you go and work in a corporate in 2 years and it's not your thing. And then you try another practice. You might have to try to find it. But I think what you're saying is, don't just give up and feel like there's no other options out there. Almost like it's almost ironically the conversation you have with the patient, right? They feel hopeless, right?
It's exactly the same.
It's human nature, right?
Just to put a little more context to my journey, it took me 10 years to get to where I am right now in terms of setting things up the way I wanted them to be in almost every way. So, I ended up buying a practice that was kind of fading, a 68-year-old dentist at the time, very insurance-dependent practice, and I had to change the philosophy of that. I had staff quit because I was essentially moving the goalposts. I was telling them we're going to focus on things other than money. We're going to do exams in a different way. I'm going to integrate some of these things that I was learning at various places. And so it's no matter what direction you turn in, you're going to create some turbulence.
Yep.
But the key to it is have a very clear vision in your mind of what you're trying to achieve, and just keep your shoulder on it and understand that there's going to be rough water, but just tack your sails to that's always the direction you're going to go. I don't know of anybody that just jumped out of school, and I know they must exist somewhere. I don't know of anybody that just jumped right out of school and ended up in the perfect situation clinically. Just life does not work that way. And, the other thing that I would say is just take a few minutes, and because I get a chance to do this all the time because my practice has a lot of them in it, just take a few minutes and have a conversation with the people in your practice that are PAs. Have a conversation with people that are MDs, that are radiologists, that are other professionals, and listen to how miserable they are. And I know for myself, every time I have that conversation, I rejoice with how much freedom and independence that I enjoy every day, and they don't have anymore because they are owned by a corporation.
Yeah, I feel the same exact way. I had the pleasure of treating many, many physicians and their children, and they would come in and they would vent. I mean, they really do. They vent. When you take the time with these people, you have an office that's structured to that. And I'm going to go to that in one other second, kind of that more boutique type office and the niche that you can have. But they really do. It's a great point because it gives you some perspective, because it can seem like you're just doing the same thing day in and day out, dealing with all these stresses, and you need to take control of your situation. You are ultimately in control of it. You may have made a bad decision. Maybe you're in a bad practice. I mean, heck, I hired an associate that I went all in on after all this time vetting and everything, and I ended up dismissing him 3 weeks into our employment. Nothing personal against the guy. It just wasn't the fit for my culture that I had thought. I'll be honest, it sucked.
And that's not an uncommon story either.
But
These are common stories.
You gotta be able to move on and say, I'm going to reshift my focus. And ironically, I wouldn't be where I am today in my professional life, in my teaching life, if that all hadn't happened. Just like you in the situation you went through in the cabinet industry. We go on these journeys and there are these seasons, and we just have to recognize that. And on the boutique side, I really like that you had said that there's always going to be, because I agree, there's always going to be a place for that more boutique style where you're really personalizing that person-centered dentistry, right? That Pengi and Barkley talked about, and you reference in the book, treating the whole patient, these themes that go throughout the book. I really do believe that. And I did that in a similar town to, it sounds like, where you are in Virginia, where in upstate New York, it was Schenectady, it was a GE industrial town, educational institutions were a large part of the workforce, and city workers, et cetera. And I never took insurance from day one. I started my own practice in the early 2000s. I never was a participating provider with a single plan. And people told me, you will never be able to make it. Everyone around here has state insurance or city insurance or county insurance or whatever it was. And if you don't take those plans, these people just aren't going to come to you. To your point, Paul, in the beginning, they probably didn't, right? I probably, because I wasn't in their list. But once I built the reputation as somebody who was person-centered, who was looking at the behavioral side of this and taking time with my patients and doing things differently, that's what grew my practice, was literally that. But that, again, to your point, was my vision. I wanted a practice that I never wanted anybody to tell me what I could and couldn't do on one of my patients. That's why I didn't go to work for anybody ever. Why I started my own shop out of residency, because I just had a vision for patient care and that I wanted to provide. So talk a little bit more about that if you could, of it, because I hear all the time from people, well, I'm in such a competitive area. I can't do that. I have too much debt. I can't afford to start my own practice. Right. And the problem with that is that one season that you maybe could change, you don't. And as it gets deeper and deeper, it gets hard. It's human nature. It's just like the patient's mouth that is decaying, degrading, right? Every 2 years of their life, 5 years of their life, what you've got to do to rebuild it gets harder and more intense. So what do you say to some of those docs who have the attitude, I'm better off just not doing this, as opposed to making some of those changes?
Well, first of all, I would say striking out on your own is a major decision. There's a lot of risk involved. There's a lot of risk in you not doing anything as well. I think if you decide to strike out on your own, you need to make sure you got your ducks in a row in terms of your clinical skill set, because you've got to be able to stand out from the pack and give people a reason to drive by 30 other dental offices to go through your door.
Yeah.
And so, and I can say it's easy, you can say it's easy for me to say that now, but I have all kinds of patients that drive a couple hours to see me from all over the region.
Same.
My practice is full of what I call seekers. They are seeking something out. In the beginning, they may not know for sure that I am what they're seeking, but they're going to give me a shot because there aren't too many other options for them. So the corporatization and industrialization of dentistry is spinning out a lot of unhappy patients that are seeking something better.
Yeah.
Right? And money to them is less of an issue than finding somebody that really cares and is willing to invest something of themselves into helping them. So this meta trend of industrialization and depersonalization of our beloved profession is running smack dab in the face of this meta trend of people wanting to get healthier and healthier. 20 years ago, I never would have imagined that there would be a CrossFit gym on every corner in my town. And people so focused on nutrition and mitochondrial health. I mean, some of the conversations that are happening in my office, I never would have imagined them would happen even 5 years ago. The level of sophistication of the things that people are consuming and the seekers in particular, they're looking for somebody that talks their languages and understands what they're looking for. These are huge market opportunities that the industrialized aspects of our profession doesn't even want to deal with because it takes too much time to actually deal with this mouth as having a person attached to it with goals and desires and fears and aspirations and whatever. You know, my fees are 3 times what Delta Dental would pay. I don't have people complaining about it. I focus my attention on making sure people are more than satisfied with what they're receiving from us. So it is risky. I mean, it's scary in the very beginning, and I wouldn't necessarily, if you have the freedom to experiment around with restructuring the way you do exams, like described in my book. And this is something I can help people with as well. But I would suggest pick a few people out that you really like and enjoy spending time with when they come in the office and just invest some time and energy in them. And I think you'll be really surprised at what happens. And then once you get a few wins in the victory column, then you gain more confidence and over time. And then what happened to me is like, I'm not going to bring another patient into my practice except for this way. And if they're not interested in that, then we're probably not a very good fit. And as the practice matured and you're drawing more seekers, that happens less and less often. So it's a step-by-step progression it is scary in the beginning. It's an all-in situation. You can't be part-time comprehensive and part-time transactional. You're one or the other because you've got to, in the mind of the public, you've got to be known as something. You're either known as like everybody else or you're known as something different, hopefully something that they want. And so to practice in this way, you're really standing out in the community in a free market way. When you're making all of your business decisions based on how insurance is structured and marketing discounts and this and that, then you're really kind of more of in a manipulative way functioning in the market. And in my opinion, you're focused on the wrong things.
And talk a little more about that if you would, because again, you go into this in the book, the race to the bottom, that is fee structure and lowering and undercutting fees. We all see the billboards, the signs, the social media ads of this. And again, just a little personal anecdote. When I opened my practice with not a single patient and no reputation, and in orthodontics, it takes a year or two to finish most, say, orthodontic cases. But yet my practice was growing within the first year, even though no one really saw whether I was that good or not in terms of my treatment mechanics and outcomes. But because of the person-centered practice I was building and the time and attention I was putting into it, I was able to draw these patients. The other part of that is I made it a point to want my fees higher by at least 10, if not 20, 25% than anyone else in my community, even though I was the new kid who really had no experience in private practice, because I knew I was going to do it differently and I wanted patients to know that as well. So the converse of that is going in and trying to undercut everybody's fees. Why is the latter a race to the bottom and going to get you potentially into some trouble in this arena?
Well, insurance distorts the marketplace and the value of everything. Let's just start with that. When you're performing a procedure, no matter what it is, a filling, a crown, an orthodontic service, it has an inherent cost to it, physically and intellectually. And when it's priced too low, that affects basically how much of yourself you're going to invest in providing that service. Mm-hmm. I think that when you set a service, when Porsche decides to design a new car, they don't start with price. They start with, what do we need to create that will compel people to want to own and drive this car? Mm-hmm. How are people going to want to feel when they get behind the wheel of this vehicle that we are envisioning? Mm-hmm. Then they create it, then they price it. Then the market responds with, we really love this, we'll write that check, or no, that was a flop, that was a bad idea. Mm-hmm. Dental insurance distorts that whole process. I think fees need to be based on what do you need to charge to create an optimal outcome every time. Mm-hmm. Yeah, and when you don't create an optimal outcome, you can afford to redo it. Mm-hmm. So everybody that leaves the office, the goal is achieved. It may not happen the first time. Hopefully it does almost all the time, but on occasion, we're human, we make mistakes, this or that happens. It's like a restaurant that serves you ordered your steak medium rare and it comes well. They don't go, oh, well, you paid for that, sorry, you just got to eat it. They bring you another one out. Mm-hmm. That's the way you need to run a practice like that. Not that the customer's always right, but you know what's right and you're going to make it right. And, it's not uncommon for me to not charge anybody for something that I do for them. If they are a long-standing patient of mine, they spend a lot of money with me, and some quick little, like yesterday, I had a gal come in and she had a lesion in her palate that had been there for a week, and she was concerned. She was paranoid that it might be cancer or something like that. She just needed somebody to look at it and pat her on the shoulder and said, that's going to be fine. I think it was probably viral and it's healing in now, and if it's not there in another week, then just give me a call. Don't charge her at all for it. It's just it's a matter. She's part of my family. Yeah. And they know that too. They can feel that. Yep. They can. So you need to set your fees in such a way that you can afford to do that. You don't feel like you have to be running the meter every time somebody walks in the door. Yep. It's about something more important than that, You've got to be backing the work up. And you made a reference to that before when you said you can't just go out and do this if you don't have the skill and the acumen to do it. Because if you're going to go in this direction, you've got to deliver a higher level service. Yeah. You have to. You've got to be really, really good. And I also want to explain that creates some pressure. So it's not that this is this utopia. You're obviously very skilled at it. This philosophy, I think it's okay to say, isn't going to be for everybody. And I think people need to figure out, again, back to your vision. What is your vision and how you want your patient care to look? If this is what you want, you need to go for it, and it may take time. But also, you can't run the high-fee boutique-style practice and be doing crazy volume and not doing those little things like you just said for that patient, or when the crown or bridge or ortho case isn't right, go, best we can get, medium well steak, oh well. You have to be willing to say, okay, I'm going to keep going with your treatment. I'm going to redo this, whatever the case is, to get it right. Would you agree with that? Yeah, I mean, the adage, if you don't have time to do it right, when are you going to have time to do it over, applies here. Mm-hmm. So you've got to set your fees at a level that you can afford to do it right every single time. And then there's a psychological aspect to it creates a higher expectation, but as long as you deliver on that expectation, that's why the high-end restaurants are going to be busy as can be tonight. Today's Valentine's Day of this recording. Mm-hmm. They're going to be jammed up. It's not, and people aren't going to be going there because they got the best deal. They're going there because they want the best experience. Yeah. And the fee goes along with that. And that's just human nature. That's just human nature. Yeah. If your fees are the same as everybody else in town, what does that imply? Yeah, well, exactly. There's a good book, Blue Ocean Strategy, and it's the concept of get yourself into that blue ocean water where no one else is. When you're where all the sharks are and there's all the blood in the water, you can't even see you because the water's blocked out by all the blood and the chum that are already in those waters. And I feel like so often because of social media and we're all pack animals. We want to run in those packs. It's hard to break from the pack
and do it differently. I find, however, that when you break from the pack is when you find the most fulfillment because you chart your own course.
I mean, I have the real luxury of hanging around with a lot of top tier restorative dentists because of my affiliation with the Pankey Institute. And there are a number of them that just are not ready to retire. They're in their late 60s and even early 70s, and they're having so much fun in dentistry because of this model, because of this concept of just really personalized care and focusing on excellence. And dentistry can be an excellent creative space if you're really good at this stuff. And that's where a lot of these people really thrive.
Yeah. Yeah, I completely agree. As we wind down here, I want to talk about the future. We've referenced it a little bit in the corporate and some of what we've talked about. I don't want to leave the guests with that we have this negative view of the profession. I don't want to speak for you, but I have actually a very optimistic view of the profession with AI and all we're doing with technology now. I think there was this big transition the past 20, 25 years where technology was so new that in many ways it complicated things more. It might have gotten us to be able to do something differently. Like I'll give the example when I built my first 3D print lab in 2016. Man, I mean, it was brutally challenging to implement that. And there was a very steep learning curve and a lot of issues. Well, now you can throw 3D printers in and hook them up to basically any scanner software program and have models printed out 15 minutes later. So we're getting through that initial surge of technology to where I really think it's going to get fun, like really fun in our profession to do a lot of what we do. But one of the other things regarding the future in the book, you said successful health-centered practices require a different mindset focused on a relationship-driven, health-centered mission. Prevention must precede repair and restoration, or it will likely fail. I'm going to read that again. Prevention must precede repair and restoration, or it will likely fail. Hence, the former should rarely precede the latter, yet most dentists do it out of frustration and financial need. And I feel like that encompasses and encapsulates a lot of what we've been talking about. And so if you would, talk a little bit more about the prevention, because that was something that Bob Barkley was big on as well, as you alluded to. He was big in thinking about prevention, and we share a common philosophy on the approach to airway and trying to stop the progression to obstructive sleep apnea, prevent a lot of these things from happening. What do you think the future holds for our profession for those who have a more preventive, proactive, patient-centered mindset versus those who continue to practice in a reactive, repair, sort of bill for your services mindset?
I think the sky's the limit for dentists that understand comprehensive care. When I use that term now, I'm thinking whole body more holistically. If you understand the airway aspects of growth and development and functionality and its relationship to bruxism and systemic health in general, and then if you dial in and really start to study the microbiome and how that's affected and how we can now successfully intervene and manage that and the tools that we have available. We have more resources and knowledge available now than ever, including on the high-tech side of things. The danger of it is, and Barkley referenced this in his book as well, is that we have all these advancements, and the danger is we can get ahead of our patients very easily. We can diagnose and propose solutions to problems that people don't yet know they have. That's what Bob used to say. So we have jumped the shark, so to speak. We are offering solutions to things that people don't yet value correcting. And that's how you break a relationship down really easily. And I talk to people like this all the time. That's how they end up in my practice. They feel like they're constantly getting pitched every time they go in for a cleaning appointment, a hygiene recall appointment. Somebody's trying to sell me a bleaching. Somebody's trying to do this and that. And if they're old enough, they go, it didn't used to be like that. But then he sold the office. And then every time I go in now, they're trying to sell me something. It just something about it just doesn't feel right. You know, people aren't stupid, and they know all this stuff. So the technology and all this stuff is a double-edged sword. It allows us to go faster, but sometimes going slower is where you're going to get a lot more productive with people.
And figuring that out is really the the hardest thing, right?
I mean, people are going to choose to solve small problems when you go fast. People are going to choose to solve big problems if you go slow and allow them the opportunity to really think about it and what they want for themselves long term. And so the whole idea of teeth in a day and all this stuff, it has an appropriate place in dentistry, but at the same time, we have the ability to take people's problems away from them without really thinking that's what we're doing, and creating these codependency relationships with people where they're just relying on us to do all the thinking for them, which over time they start to resent.
Yes.
So there's a lot of psychology in dentistry, and it's something that we got almost no training in when we were in school.
Yeah. Yeah, it's so true. It seems like part of the challenge here, and this is what Bob Barkley was hitting on, this is actually really complicated. It's multifaceted. To be a really good, successful dentist, whether you're generalist or specialist, you have to have such a skill set, from your dexterity to your didactic knowledge to your personal skills to your understanding of the behaviors and the psychological implications, like we were just talking about, of your patients and how to communicate with your team members.
Right.
You have to be able to be hyper-focused and talk to no one for certain procedures, but also be completely social and gregarious and talking to everybody and leading a team. And it's very multifaceted. And then the other part of that is, especially if you own or run the business side and the financial side.
Right.
You're doing multiple jobs. And it's coming to me now as we're having this conversation, but I think maybe that's one of the reasons, because we're also type A and driven, and we've been so successful in our own ways. I feel like it's not possible for us to do all of those well, especially early in our careers. And maybe that's why a lot of these younger docs are feeling unfulfilled, because they feel like they just can't be as successful as they've been throughout their schooling in all of those arenas.
I think there's a lot of truth to that. The beauty of the way I practice, and a lot of the people that I hang out with, and we'll see next week at the Restorative Academy meeting, the beauty of this practice model is you don't need to see nearly as many people in a day. You can be much more productive per hour with fewer people, so you don't have the level of people management. You don't need as big of a staff. You don't need as big of a facility. You don't need as high of an overhead. You don't need to be running 60, 70, 80 new patients through your practice a month. You can do it on 10 or 12 as long as they're seekers. So people are coming to you for a reason, and you're the reason that you've got a skill set and a knowledge set. It's something that they're interested in learning more about. And so if you get more and more effective at getting people engaged and saying yes and proceeding towards some goals, then you don't need a huge practice to do that. That's exactly how Bob Barkley practiced as well. So part of the vision of this is really envisioning yourself slowing down and enjoying your days more, and having time to do some of these other things, and having time to just stop in the hallway and giving your assistant a hug and say, I really liked the way you handled Betty today. That was like freaking masterful. Or I overheard you on the phone today and you just killed it with that new patient. The way you answered her questions and relieved her anxiety was just a 10. I just want to let you know that. Tom Peters wrote a book many years ago, I think it's called Managing for Excellence, I think, and there was a phrase in there that's always stuck with me, and he called it management by walking around. And that's just being present enough about everything else that's happening in your office when you don't have your hands in people's mouths, that you've got control of it. You don't need a big management structure. You don't need an office manager. You can be it. If you've dialed it down and you're productive with each person and your fee structure is appropriate, then this is a business model that works very well. A lot of people are prospering in this business model as inflation keeps going up. I mean, it was it's gone up probably 20% in the last 4 years, inflation. If you're stuck in a insurance model, where's the compensation for that?
It's not there.
Your staffing payroll has gone through the roof in that same time period. So this is what's destroying praxis, and why a lot of people are stressed out as well, is that the math isn't working anymore.
Yeah, that's so well said. And what you just described was very similar to the practice I worked to build. And the times that I felt the most out of balance was when I got so busy. And that's why, for me, we literally would push new patient exams out 4 or 5 months sometimes. And people would say, consultants say, you're crazy. But to your point, that's where I could stay focused and be present for my team. And it's easier said than done, but I just hope people take what you just said to heart and realize it's possible. And I thank you for just explaining that.
Yeah, Omer Reed was famous for saying, if it's been done, then it's possible. So the key is to find people, find a mentor, find somebody that's doing it, and just hang around with them, just like I did with Bob Muncie, and get your mind impregnated with the idea of maybe practicing in a very different way, and then what you need to do to get there. And it's going to be, it's a journey. It takes time, but it's possible.
I can't thank you enough for coming on and going into that type of detail. This is an episode that I will be telling residents that I coach and teach for many years. I will be saying, go back and listen to this episode, because the things that you talked about are the things I know are in so many young docs, especially, I'm sure older as well, but young docs' heads. And I just hope that they take it to heart and realize they can set their vision and put themselves on a path to fulfillment, because it is such a wonderful profession.
It truly is. Yeah.
Right. And there's just so much in it that we can do, and it can be very lucrative and very enjoyable. And it saddens me to watch the trend going the other way. And I appreciate you fighting that fight to prevent that from happening. How can people reach you if they want to contact you? Is there any way they can follow you or get more information about you? I'll put a link to the book Co-Discovery in the notes as well.
If you participate in Facebook, I write usually one or more times a day on all of these kinds of topics, short little pieces, short little essays, very targeted on a topic. That's a great resource to just get a better feel for where I'm coming from and how I think. I'm involved was co-founder in the study club, Bob Barkley Study Club, and we have usually a couple meetings a year with like-minded people where we're discussing these exact things. You can contact.
Can people just apply to the study club?
Not you don't have to pay to be involved in it or anything. It's just a philosophical group of people.
Okay.
Philosophically aligned group of people. And you can get in touch with me personally by just emailing Paul at paulhennydds, Paul at PaulHennydds.com, and I'll respond to you and point you in whatever direction I think would be helpful for you.
So great. Dr. Paul Henny, what an absolute pleasure to have you on and sharing your insight and wisdom. And I really respect and appreciate your passion. You are far into your career. As you said, like 40 years now, essentially, into your career. And to have this type of passion and desire to be wanting to pass it along and give it along, there's nothing better. So I can't thank you enough.
You're very welcome. I love dentistry. It's my heritage, and I want to see the private care of dentistry continue. So we've all got to pull together and make it happen.
I'm right there with you, right in lockstep. So thanks so much, Dr. Paul Henny. Appreciate it.
All right.
Thank you for tuning into this episode of the Doc Podcast. Be sure to visit theorthocoach.com to get access to ADA CERP recognized CE courses or to schedule a private one-on-one coaching session with me. Also, if you know of someone who would make a great guest for this show, or if you'd like to be a guest yourself, please email me at drmike@theorthocoach.com. And be sure to join the Doc community on Facebook for more great content. Thanks so much for listening, and always remember, you have been blessed with the ability to do amazing things.